Imagine this. You wake up one morning with a slight headache. Nothing major, but it's enough to catch your attention. Then, as the day goes on, that tiny discomfort begins to grow in your mind. You start thinking, what if it's a sign of something serious? You reach for your phone, open Google, and before you know it, you're scrolling through pages about brain tumors and neurological diseases. Now, that once minor headache feels like a ticking time bomb. You've convinced yourself it's something fatal. Sound familiar? But what if I told you there's a way to break free from this cycle of worry? In today's video, we'll uncover the signs of health anxiety, explore why it happens, and share proven strategies to help you regain control of your mind and your life. Hit that like button and let's dive in. So what is health anxiety exactly? Health anxiety, or hypochondria, is the persistent and obsessive worry about having a serious illness, despite medical reassurance. In fact, medical reassurance often doesn't help. And that's the frustrating part. You see, even when a doctor tells you you're fine, you might still find yourself doubting it. Sound familiar? Well, that's because anxiety isn't logical. It thrives on uncertainty. Health anxiety can manifest in two ways. Some people focus on every little symptom and constantly seek reassurance from doctors. Others avoid healthcare altogether, terrified that a diagnosis might confirm their worst fears. Why does this happen? Well, when you experience anxiety, your brain's fight or flight response kicks in, and your body releases stress hormones like cortisol. These hormones prepare you for danger, except in this case, there's no real danger. It's just your mind playing tricks on you. Here's where things get tricky. Your mind begins hyper-focusing on bodily sensations, things you'd normally ignore. A slight twinge in your chest becomes heart attack's territory. A small rash suddenly means you've got a rare disease. And once you're down that rabbit hole, your anxiety skyrockets. You might even start feeling symptoms that aren't even there, purely because your mind is in overdrive. But how do we break free from this cycle? Let's dig deeper. You may be wondering, do I really have health anxiety? Or am I just being cautious? Well, let's break it down. If you recognize any of these signs in yourself, it might be time to start addressing health anxiety head-on. 1. Constant worrying about your health. This is the hallmark of health anxiety, the constant nagging worry that something is wrong with your body. You might jump from one worry to the next, often after seeking reassurance. 2. Frequently checking your body for symptoms. Do you find yourself checking your pulse, looking at moles, or inspecting your tongue in the mirror? This constant checking only reinforces the anxiety because every little thing becomes a potential sign of illness. I remember a time when I spent hours daily checking my throat in the mirror, convinced that something was wrong because it felt sore. Every day, I would go back, only to find nothing had changed. But that never eased the anxiety. 3. Excessive Googling of symptoms, hypochondria. Dr. Google, the ultimate fuel to the fire of health anxiety. One search leads to another, and before you know it, a minor symptom has escalated into a terrifying diagnosis in your mind. 4. Seeking reassurance from doctors but still feeling unsatisfied. This is a key feature of health anxiety. You go to the doctor hoping they'll say you're fine, but when they do, it doesn't help. You feel relieved for a moment, but soon enough, the doubt creeps back in. 5. Avoiding doctors or tests out of fear. On the flip side, some people avoid medical checkups entirely because they're terrified that their fears will be confirmed. This avoidance, though, only prolongs the anxiety. 6. Overthinking health-related news. If you're someone who feels triggered by health-related news stories, maybe hearing about a rare disease sends you into a spiral. This is another sign of health anxiety at play. 7. Physical symptoms of anxiety. Finally, health anxiety often creates its own physical symptoms: tightness in the chest, headaches, stomach aches. The irony is that the anxiety itself can mimic the very things you fear. Why does our brain latch onto these fears? Well, it's rooted in the brain's natural tendency to protect us from harm. Even when there's no real threat, our brain is hardwired to focus on danger. It's a survival mechanism. The problem is it can't distinguish between a real threat and a perceived one. When you focus on a symptom, your brain magnifies it. And the more you think about it, the more real it feels. It's like when you hear a strange noise at night. At first, it's just a small sound, but the more you focus on it, the louder it becomes until it's all you can hear. That's how health anxiety works. Now, here's the good news. Health anxiety is manageable, and cognitive behavioral therapy, CBT, is one of the most effective treatments out there. CBT works by helping you identify and challenge the distorted thinking patterns that fuel your health anxiety. Often, when we feel anxious about our health, we fall into what's called catastrophic thinking. It's when your mind automatically jumps to the worst possible scenario. Maybe you feel a slight ache in your chest, and instead of thinking, it's just a muscle strain, your brain goes straight to, what if it's a heart attack? That's where CBT steps in. It teaches you how to catch these thoughts as they arise, question their validity, and then replace them with more balanced, realistic beliefs. By practicing this, you can essentially retrain your brain to stop spiraling into panic every time you experience a symptom. Let's dive into one of the most practical and powerful tools in CBT, the thought record. If you're new to CBT, this exercise can be a game changer. Here's how it works. Every time you feel anxious about your health, you grab a pen and paper or open up a notes app and you write down the specific thought that's causing you stress. For example, let's say you've been feeling a headache coming on, and immediately your mind jumps to, I must have a brain tumor. That's the anxious thought. You write it down. Now, here's where it gets interesting. Instead of letting that thought run wild, you challenge it. You ask yourself questions like, what's the actual evidence for and against this thought? For instance, have I been diagnosed with a brain tumor? Have I had similar headaches before that turned out to be harmless? Is there a more realistic explanation? Maybe the headache is due to dehydration, stress, or lack of sleep, far more likely scenarios. By walking yourself through this process, you can start to shift your thinking from the automatic worst-case scenario to a more balanced and logical perspective. You're essentially giving your brain a moment to pause, step back, and reassess the situation with a calmer, clearer mind. Think of it this way. The thought record is like putting your anxious thoughts on trial. You're the judge, the jury, and the defense attorney, all working to bring reason back into the courtroom of your mind. But why does this work? When you're anxious, your brain releases stress hormones like cortisol, which can make your thoughts feel chaotic and overwhelming. The act of writing down your thoughts and questioning them forces your brain to slow down. It engages your prefrontal cortex, the part of your brain responsible for logic and decision-making, rather than letting your amygdala, the fear center, run the show. This shift helps you regain control over your thoughts. So, how can you start using CBT in your everyday life to manage your health anxiety? Here's a quick guide. 1. Identify the trigger. Pay attention to the situations that set off your health anxiety. Is it a specific symptom, like a headache or dizziness? Or maybe it's reading something alarming online? Once you identify the trigger, you can start tackling it with CBT. 2. Record the thought. Grab your journal, phone, or a piece of paper. Write down the exact thought that's causing your anxiety. Example, I'm having chest pain. It must be something serious. 3. Challenge the thought. Now, ask yourself, what's the evidence that supports this thought? What's the evidence against it? Is there another, more logical explanation? For example, maybe you recently exercised or had some indigestion, more likely reasons for chest pain. 4. Reframe the thought. Finally, rewrite the thought in a more balanced, realistic way. Example, this pain is most likely a result of muscle soreness. If it continues or gets worse, I'll check in with a healthcare professional, but it's probably nothing serious. By practicing this exercise regularly, you're training your brain to stop jumping to worst-case scenarios. Another most powerful techniques for overcoming health anxiety is exposure and response prevention, or ERP. Now, this method might sound intimidating at first, but let me assure you it's a game changer. ERP is all about facing the fears that drive your anxiety, and here's the key: sitting with that discomfort without giving in to the urge to seek reassurance. ERP works by slowly and gradually confronting the fear, allowing your brain to learn that the catastrophic outcomes you're dreading are incredibly unlikely or even impossible. The more you practice sitting with your anxiety, the more you'll realize that your fear starts to lose its power. It's about retraining your brain to respond differently. Let's break down the process into simple, actionable steps, so you can start practicing ERP in your daily life. Here's what it looks like. 1. Identify a fear. The first step is recognizing the specific fear that's triggering your health anxiety. For example, maybe you've been worried that a recurring headache is a sign of something serious, like a brain tumor. Your mind races with all the possibilities. What if it's not just a headache? What if I need to see a specialist? This is where you start. Identify that exact fear and get specific. What is it that you're truly afraid of? It's important to get clear on the fear because the more specific you are, the better you'll be able to challenge it. 2. Expose yourself gradually. This is where the exposure part comes in. Instead of avoiding the headache or rushing to Google your symptoms, ERP asks you to do the opposite: confront it. You sit with the sensation of the headache without reacting. You resist the urge to dive into internet searches, call your doctor, or even check your reflection to see if you look pale. The key is to allow yourself to experience the fear without running from it or trying to soothe it away with external reassurance. Now, here's where most people get stuck. You might think, but sitting with the fear will make it worse, right? Actually, no. This is where the magic of ERP lies. The longer you expose yourself to the fear without reacting, the more you'll realize that nothing catastrophic is happening. Your headache isn't getting worse, and there's no heart attack around the corner. Think of this as building mental muscles. The more you practice, the stronger your ability to face the fear without it overwhelming you. 3. Prevent the response. The final step, and arguably the hardest, is preventing the compulsive response, the thing you usually do to try to ease your anxiety. For most people, it's seeking reassurance. You might want to check your pulse, ask someone for their opinion, or Google symptoms to get a sense of control. ERP asks you to resist that urge. Here's why this is important. When you seek reassurance, you're giving the anxiety power because you're telling your brain that the fear is valid. But when you resist the urge, you're sending your brain a different message. This fear isn't as serious as I thought. It's like breaking a habit. The more you resist the reassurance-seeking behavior, the less you'll feel the need to do it over time. Eventually, the fear that felt so overwhelming at first will shrink. It's a gradual process, but it works. Remember, you don't need to be perfect at this right away. It's okay if you slip up sometimes. What matters is consistency. Keep practicing, and the results will come. You might be wondering, does this really work? And the answer is yes, absolutely. ERP has been extensively studied and proven to be effective in treating a variety of anxiety disorders, including health anxiety, obsessive-compulsive disorder, OCD, and generalized anxiety. The reason it's so effective is that it rewires your brain. When you avoid your fears or seek reassurance, you're actually reinforcing the anxiety. Your brain learns that these behaviors keep you safe, so it repeats them. But with ERP, you're doing the opposite. You're teaching your brain that it doesn't need to panic or react every time you experience a symptom. This retraining allows your brain to learn that the feared outcome is either extremely unlikely or not a threat at all. Let's talk research for a second. A landmark study published in Behavior Research and Therapy showed that ERP was highly effective for patients with hypochondria, leading to significant reductions in both anxiety and fear-based behavior. Over time, participants who consistently practiced ERP found that their fears lessened, and they regained control over their lives. The best part? These results lasted even after the treatment period ended. To make this even more relatable, let's walk through an example. Say you have a fear of developing a serious illness every time you feel fatigued. Normally, you might immediately search for symptoms of chronic diseases online, or ask a friend if they think your tiredness sounds abnormal. But with ERP, here's what you do. You acknowledge that you're feeling tired, but you don't act on the fear. You let the thought come and go without investigating it. Maybe you set a timer and decide that for the next hour, you won't look up anything online, no matter how anxious you feel. Instead, you'll sit with the discomfort and trust that the fear will eventually pass. This might be uncomfortable at first. Your heart might race, and you may feel like you're on the verge of panic. But as the minutes tick by, you'll notice something amazing. The anxiety peaks, and then it starts to fade. Over time, your brain learns, hey, I survived that. Nothing bad happened. The fear loses its grip on you, and with continued practice, you'll find yourself reacting less and less to those anxious thoughts. Managing anxiety isn't just about mental techniques. It's also about making lifestyle changes that support a calmer mind. 1. Mindfulness and meditation. Mindfulness teaches you to stay present in the moment, rather than getting lost in future what-if scenarios. A simple daily practice of just 10 minutes can start rewiring your brain to focus on the here and now. 2. Exercise. Exercise is a natural anxiety reliever. It reduces cortisol, increases endorphins, and helps burn off that anxious energy. 3. Sleep and nutrition. Good sleep and a balanced diet are foundational to a healthy mind. Lack of sleep amplifies anxiety, and poor nutrition can leave your body feeling off, which your mind might misinterpret as a sign of illness. 4. Write down your symptoms and bring them to your doctor. Ask all your questions in one go and write down the answers so you can refer back to them instead of jumping online. Challenge your automatic thoughts. When you feel something odd, instead of assuming the worst, remind yourself, I've been checked out. This is anxiety. 5. Get physical. Go for a walk, do some yoga, or hit a punching bag. Shifting your focus from your symptoms to physical movement can be a game changer. 6. Create barriers. If you're prone to Googling symptoms, Put your phone away or set limits. Stop feeding your fears. What's the one thing you're going to try from today's video? Drop your commitment in the comments below and let's start a conversation.